Let's start our presentation. Thank you very much again joining us, and I will do my best to introduce the program and introduce myself as well. I think it's quite important, isn't it, to see your program director, who is this person and how is the background and so on. But initially, I would like to start with our Royal London Dental Hospital and our history. Queen Mary has a really long history, and I am on and off with Queen Mary for 30 years. Therefore, I'm very close to like Queen Mary. Like a Queen Mary girl, I say, or alumni. So you can see that the dental school opened 1911. So we are one of the oldest dental schools in the UK and maybe even in the world. I'm not sure. I don't want to say anything incorrect, but this is our sort of timeline. And then hopefully you will come and study here in this wonderful building. We moved here, I think now it's like 9 years ago, and everything is, state of art, contemporary, very lots of sort of clinical skills lab chairs. We have the research facilities on the top. This is Blizzard. If you are interested in microbiology, so we can mainly microbiology and cancer research is going through tissue engineering as well. So you will be using this. We have different sort of campus as well. So we have Myland, and the dental physics laboratory is there. So a majority of the MID projects are carried out there. And then the bottom left picture is our library. So I was like you when I qualified. I came Queen Mary to do my MSc master program, and I love that library because it just gives you a very calm atmosphere, and you just want to read there and just enjoy and revise as well. So this is what I wanted to share with you. And then this is our clinical skills lab, and we have the microscopes as well, at least 19 microscopes. And with MID, I use the microscopes, and I will show you some of the selection of cases as well. So, being an specialist in endodontics and prosthodontics, I hope that you can imagine I am very obsessed with microscopes. And who is Aylin Bison, who is your program director? I believe that I am passionate about education, but at the same time patient care, optimum patient care and research. So in MID program, you will carry out research, and you will see that I do my best for my students to present their research, or if they cannot go to the national or international meetings, I go and present their projects and publish as well. And you will see it's a 1 year program, but we work very hard and we have outputs as well. So, as I mentioned, 30 years ago, I came here like yourselves. I did my MSc in gerodontology, and you have a component module in gerodontology as well with respect to MID. And then once you finish your MSc, depending on if you want to go back to where you are from, or if you want to do further studies, or if you want to work in a practice, there are opportunities. With me, I was going to go back to where I came from, but I was offered to do a PhD funded from UK, and so this made me to stay here. It wasn't my intention, and then due to the family, I met with my husband, so I had to stay and register to the GDC, General Dental Council, and I always wanted to be an academic. Therefore, I had to take all these Royal College of Surgeons exams. So if you are interested in academia, these or Royal College of Surgeons exams are very prestigious, and it will be good even if you go back. It will be good for your progression as well. And then I did my clinical training again, UK funded NHR trainee in endodontics, prosthodontics, restorative, and I'm registered specialist in endodontics and prosthodontics. This is why MID and all these specialties fit really well, and I explain how. As I mentioned, I am passionate about my education. Therefore, I went and studied the higher education degree as well. And with that degree, what we do is it was an 18-month program. It's called PGCAP, Postgraduate Certificate in Education, and run by Advanced HE, which is the regulatory body for education in the UK. And I thought that this is not enough. It's you get the fellowship with that PG because you know these qualifications help me to reflect my teaching, to reflect my academic sort of career, and it improves the way I approach to teaching, research, and clinical practice. Therefore, I applied to become a senior fellow, and then after senior fellow is the highest degree is principal. Very few dentists, even very few academics in the world, it's a world recognized degree. So very few academics hold this principal fellowship. I am proud because it helped me genuinely to oversee what I am doing, what is my vision, because you talk about your vision, it's an application process, and it makes you a better academic. For me, it worked for me. And then with the MSc in MID, we introduced at Queen Mary after hundreds of committees, lots of committees in 2020. And since to date, I have really good students. I'm very proud of the program, and they achieve a lot. They do really well, and I follow them as well afterwards. And I say them, you are MID ambassadors. They are my sort of group that alumni I am collecting, and my mission is to have a more like international level. Yes, I introduced this International Association for Dental Research, Minimally Invasive Dentistry network. I'm the founder. This was for everyone, but what I want to do is with my alumni, I want to do a like a ambassador sort of position, something. I have an idea, but I couldn't explain now clearly. But so they are doing really well. Most of them, either they go back to their own countries or they move to US, they work there, and then or they stay here and they work there. It's for me, this program is not only, of course, minimally invasive dentistry, but is like a life learning as well and progression. So, my PhD was really, I'm again very fortunate that I was the first investigator for in the world for that high fluoridated toothpaste to be used in root caries. And during the program, I discuss this high fluoridated toothpaste when we do the seminars on management of dental caries. And then the other part was ozone. So again, I was the first person to use ozone on root caries especially. So I'm fortunate that we managed to get a patent as well from there. So any ideas are possible while I am showing this, because if I have done it, you can do as well. And why not? If you have an idea, you may say that, oh, 1 year, how am I going to do this? But we can build up. And if you have any innovative idea, that please share with me, because I am very open, and you never know what happens afterwards. Okay, so this is the reason that I wanted to show this to you. So let's come to the overview of my talk about MID program. What is really MID? There is still some misconception amongst everyone. Don't worry, it's not and you are, I think you know that what is MID, because you chose this program, which is I am very fortunate and proud of you. And how is this MSc in MID at Queen Mary? I will talk about the module descriptions and student testimonials, summary, and take-home message. So for me, the MID is not like, seeing the patient and then, yes, I do the best implants, I do the best crowns, or I do a full smile sort of performance or full mouth recon. But end of the day, if the patient education is not there, if the onset and progression of disease is not there, nothing will work. If imagine if a patient comes and if their own teeth, they cannot survive to dental disease, how the treatment, all these veneers, implants, full mouth recons, how they are going to survive? Therefore, the concept of MID is based on all factors. So holistic approach, we look at the holistic approach of the patient, what is going on here, the effect of the onset and then progression of disease, therefore integrates concepts of prevention. Yes, we do the treatment, but we say how we can prevent the future disease from happening, and then control and treatment. So I genuinely believe that it is my sentence, I genuinely believe that my statement, future is shaped by the decisions we make today. So you decided to be with us and you decided to do this unique MID course, which is the only course in the world. And it's wonderful opportunity for clinicians who wants to understand the holistic approach, because the early detection is very important, not only for dental caries or tooth wear, for all dental disease, that it is early detection and management strategies can have an enormous socioeconomic impact in all countries, and we need that, isn't it? The resources are getting smaller and smaller, minimal, so we need to have some socioeconomic impact as well in our dental treatment. The MSc will give you a comprehensive insight into the concept of MI dentistry. So you will focus on major dental issues, and I will share with you the modules as well, and then arise across all age groups. As I mentioned, we have a gerodontology module, so we concentrate on the aging population, which is a very significant in the world, isn't it? And then learn how to adopt a minimally invasive approach to treatment and give your patients a sophisticated holistic level of care. So what are you gaining really? Firstly, as I mentioned, this is a very unique course. This is wonderful. Secondly, you will have the opportunity to study one of the UK's top-rated dental schools. And also you will be able to combine the academic study. So you have didactic teaching, and I will show you the modules. I forgot to mention the previous slide, all age groups. So you have a module with pediatric dentistry as well, pediatric dentistry in relation to MID, research and clinical skills to gain an all-rounded training. This is like foundation of your progression, career progression. Then you can decide what you want to do. You can go my way, academia, or you say, no, I want to work in general dental practice. Yes, you can. Or you say, yes, I want to work in general dental practice, but I want to be a specialist. Yes, you can go that way as well, because after your dental school, this will be a good base for you to apply the more clinical and long courses, such as, declin dents and so on. By the way, I introduced the declin dent in MID, but with COVID, we had some shortages of chairs for everyone to use, because in the hospital we have the service delivery and we have the undergraduates and we have the postgraduate programs. So therefore it is on hold currently, but my passion is to introduce that one as well, because this one is 3 years and you never know what happens later on, because in future you never know, maybe the MID, when I say, people laugh at me, but maybe MID is going to be a recognized specialty as well. So this is another opportunity. And then at the same time, distinguished international experts and have regular contact throughout the course. What I do is such as sorry, what I do is such as saliva. We have a saliva seminar, and um, if when I see that, oh, there is a world expert in saliva, I reach out them because we have this online options as well, and we have that saliva expert giving you the seminar online. So that kind of opportunities throughout the course. And focus on the latest developments as well from the clinical dentistry, and at the same time research as well, innovative techniques, and I'm very open to new ideas as well, of course within the logics. If you can tell me, if you tell me I want to develop a tooth, I love it, but we have to be realistic as well in 1 year. But maybe we can contribute to one part of that tooth development. So because I mean, I love the innovative approaches. I love the new ideas. So please feel free to share with me when you come to the course. You will have the hands-on clinical experience. Initially, we will start with the clinical skills lab and then move to the patient treatment. So this is a very, again, unique opportunity for you to get in 1 year. You will have that patient exposure and patient experiences as well if you want to take your exams to practice in the UK. So this is a wonderful idea that you have the knowledge of MID, but at the same time you have the opportunity to practice as well. So the program outline is we will have the formal seminars given by experts in their field. I'm not the only tutor on the program. Um, when such as periodontology seminar is carried out by an expert in the world, that kind of, we have ethics again is carried is delivered by another expert in the UK, and so on. You will have the preclinical laboratory sessions. So before the prior to the patient treatment, you will learn the techniques or enhance, because you already learned this from your dental school you graduated. So such as veneers and so on, maybe you're not very sort of you don't have the experience, so you will have that kind of opportunities on layers, veneers, composite build-ups, and then you will transfer these knowledge and experiences and skills into the patient treatment, into the clinical practice. You will have the case presentations involving your case management, and end of it, we will have the component within the assessment. So it is part of the assessment as well for gerodontology module, and then for MID 2 module as well, more clinical MID module, and also pediatric dentistry module. You will have the case presentations and discussions with all the tutors, with me, and reflection, because reflection makes us a better person, I believe, and better clinician, better educator, and review of the outcomes as well. So you are going to use the haptics. So we have a haptic suite. So I just want to, can you hear the sound? Can you hear it?
Yes, yes, yes.
Excellent. Yeah, this is our suite. It's our Excellent. Every time I see, I get excited. Sorry, why I can't. Um, hmm. Okay, so these are all compulsory modules. All your modules are compulsory. So it's quite intensive course, but enjoyable course. So you will have the dental materials. This is shared. So you will have other peers as well, which is nice. It's wonderful to meet with different people and for networking as well. And you will have the properties of dental materials too in the second term. So autumn term dental materials 1 and this term like spring and summer dental materials 2. As I mentioned, you will have the older population and oral health with minimally invasive strategies. This is MID specific, and exciting part is again a very unique opportunity. I There is nothing like this in the world that I have the geriatric medicine collaboration for that module. So geriatric medicine consultants come and give their seminars. I have my seminars as well, gerodontology. And then you have the work placement. This is never seen anywhere again in any of the master, even the clean dents. So you go there to the geriatric wards in our one of our hospitals, Whips Cross, is part of Barts Health. So we are Queen Mary, but we have the partnership with Barts Health. It's the NHS hospital, and the Barts Health has different hospitals such as Whips Cross, Royal London, Barts, St Bartholomew's in Farringdon, and so on. So in the Whips Cross we have the geriatric wards, and you will have the opportunity to have the work placement there and observe patients and um, interestingly, um, I have something news, but I will tell you when you come because it's still happening and so on. I want this to be surprise. Very, very nice surprise. It's very positive. So this part as well, you will have the experiences of seeing patients, and the surprise is relevant something to clinical practice, but when you come. So join us. Okay, and the other one is fourth module, oral health management for children by implementing MID techniques. Again, this is MID specific. And this module is delivered by one of my colleagues, pediatric dentist. And ideally, we wanted to have the patient care here. You have the clinical skills lab procedures. You will learn how to do whole technique. You will learn how to do ART, fissure sealants, and so on. All MID related techniques. But due to all these safeguarding issues and so on, currently we don't have the patient treatment for children, but you have the patient treatment for older population and MID for young population as well, above 16. So this is again very unique opportunity that you have an overall care of different specialties. Minimally invasive dentistry in restorative dentistry. This is again, actually, it is not really, it is shared in a way, the first part, the MID one. So within this one, you have two components. The first one is MID one. It's shared with dental materials and oral biology, but they don't have the clinical. They are not clinical. They are non-clinical programs. And then MID two with me again, the MID1 with me as well. You will have the seminars, and MID1 you will start seeing patients, not them, only you, because it's a clinical program. But MID2 is specific only for MID students, and they will continue seeing patients. The patient demographics will be adults, and you will have the opportunities to do um, really restorative work and considering the MID techniques as well. And I will share some examples of previous patient care. So research methods, this is shared. You have the FRM module, and you will have lots of like declin and all the other programs within Institute of Dentistry, which is nice, you know. So you don't sometimes you don't feel isolated, or if you want to feel isolated. So it is all inclusive. It's for everyone, this program. And then oral microbiology pathology again shared, and research project. Initially it will start because of the FRM, and then we will identify. I am a type of a program director is I let my students to tell me their ideas, because this is what I did when I came here 30 years ago. I had an idea about soft lining materials that I can cure them. I can make them hard in microwaves. This was never done before, and my program director allowed me to carry out my research, of course, within the resources that we have. And this is what I do. Some other programs, they have a list of projects and they choose their projects. With me, I have research discussions starting from even at the beginning, October, so that when we come to January now, all my students know their work, what they are going to do, and we finalize the methodology by January, end of January. So this is for me, I think it's a really good approach. But if you have any ideas that, you know, if you want to see the list, yes, I can give you the list, because I have quite few projects as well. Okay, so these are the outputs. So, you know, maybe you were told it's a 1-year program. How can you do this? Can you publish? Yes, you can. And these are the evidence. So my students are publishing their work. So Marta was a wonderful student again. Eleni was a wonderful student, and they published, and we have more as well coming through. We have this exciting project, 3D printed typodons. This is an in-house tooth that I'm working with one of our alumni PhD students. Now the PhD student moved to Plymouth, but we are still working together, collaborating. So this is for me is like very exciting opportunity that I would like to create a tooth with root canal system I haven't seen in the world. I keep asking, talking, and I did a presentation as well. So I just wanted to share that one of our, you know, research ideas, this one as well. So this we have a Tactitude website, and we shared all the recipes how you can print. So if you have it in your schools now, if you have a 3D printer, you can get that website. It's all free and open to public as well. I can send you the website details, and you can have that recipe to print that kind of teeth. So these are the now patient treatment. We are coming to the end. As I mentioned to you, we have a comprehensive work, and at the same time we look at the holistic approach as well. So this patient had a trauma. You can see all these teeth, and these ones, all the trauma assessment, endo assessment. If there is a need for endodontic treatment, we provide as well. And these are all not full mouth recon, cutting the teeth and invasive approaches. This is all composite buildups, and it's amazing results as well. So as I mentioned, we do bleaching as well following the root canal treatment. This was a discolored tooth, and one of the MSc students did a root canal treatment because it was devital, that tooth, and non-vital. And after the root canal treatment, we did internal and external bleaching, and this is the outcome. So really nice cases. And lastly, I just want to share you the one of the students' testimonials as well. I don't know if you hear. Let me see. Please let me know if you hear.
That I have a basic approach to patient management. So I thought I should get the academic qualification to further my career. Also, I truly believe that MID is the future, and hence I decided to take up this course. In the MID program, we have a holistic approach and have an evidence-based patient care. We focus on the cause of the disease rather than having a mechanical drill and fill management. My favorite part of the program is the clinical hands-on work where we implement the latest technology and dental sciences. And it's truly an honor to have Dr. Besan as the program lead as we get to learn so much from her every single day. This course is one of a kind, niche, and is adept in its innovative approaches. This course is very useful for dentists as it not only provides the scientific knowledge, but also allows us to implement this knowledge clinically. In the recent years, and especially due to the pandemic, dentistry has changed, and the less is more approach has become the way to go. Queen Mary University of London is a very reputable school and is one of the best for dentistry. QMUL's strong focus on research attracted me towards it as well. It's situated in the heart of London, and I wanted to live the happening life of London. Also, studying at Queen Mary, we get to learn about different cultures and meet people from all around the world, which is a great experience.
Excellent. So I hope you had a chance to hear the testimonials as well. And now, summary. So I believe that in the 21st century, we have to be ahead of everyone. Innovative early detection with personalized preventative management strategies are crucial for the optimum patient care. And as my last slide, and not least, take-home message is less is more and usually more effective. Thank you very much.